Thank you so much for joining us for this kickoff of our Insight and Inspiration series. And I just want to remind our participants that this event is being recorded, and we'll try, as Ava mentioned, to get to all your questions. We want this to be an interactive and engaging session for you. When we were conceiving of how we can help support the public health workforce in this COVID crisis, at ASTHO, we really thought about the need for inspiration and the need for insight and our desire to connect. And so those themes came together in the creation of our Insight and Inspiration series, which will be monthly opportunities for governmental public health and folks working in public health and partners in public health. Just listen and learn and share thoughts, insights, and inspiration as we continue to address this COVID pandemic nationally and globally. And it's really an honor for me today to welcome Josh Sharfstein to the kickoff meeting of Insight and Inspiration. Many of you may be familiar with Josh's work. He is currently the Vice Dean for Public Health Practice and Community Engagement, as well as a professor for the practice in Public Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health. And he's a pediatrician, and he's worked as the Commissioner of Health for the City of Baltimore, as well as the Principal Deputy Commissioner for the FDA, and as ASTHO alumni, the health official, state health officer and commissioner for the Maryland Department of Health and Mental Hygiene. So you've worked at all three levels of governmental public health, and you are a public health icon and inspiration for many of us. So welcome, Josh. Thanks for being with us and taking some time today to share. I thought I would kick off by reminding folks that you're actually, in addition to all of those very heavy duty jobs, you still find time to write. And Josh is the author of the Public Health Crisis Survival Guide, which you wrote a couple years ago, not anticipating the worst global pandemic in 100 years, but how opportune for putting that book together. Tell us a little bit about the book and how that came to be.
Sure. Well, first of all, Mike, thank you so much, and thanks to ASTHO for having me. It's great to be here. I really appreciate your team and your inviting me, and great to be talking to people in public health around the country who are doing, the most important work perhaps of your whole careers right now, protecting your communities. So I really deeply appreciate the challenges that you're facing, the struggles, the misunderstandings that you have to sort through. It's just incredibly important. When I started 5 years ago now at Johns Hopkins, right out of having worked in a state health department, I walked in and they asked me to do a course. And I thought I would do a course about, some general public health practice or public health policy. And every time I kept suggesting the course, it would have to get submitted to this committee that exists. The committee basically has one function, which is to determine whether there's another course with the same name. And the first 3 courses that I, gave had the name like Difficult Decisions in Public Health. And they were like, you can't teach that. There's already one on difficult decisions in public health. So, and I was like, I don't know what I could teach. And my department chair, who's now the dean, said, why don't you think about what course you wish you would have taken before you became a health commissioner. And that was suddenly really easy because the whole time when I was thinking about going to work in public health, I got a lot of advice, go on a listening tour, think about your strategic plans, what are your top 5 priorities? And then I got into the job and it was just like crisis, 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 crisis all the time. I mean, it just never let up. My first week, we had people dying from hypothermia. We had a rabies problem. We had all of our research got suspended by the Food and Drug Administration. It was just, one thing after another. And I realized, like, if I couldn't handle crises, if I couldn't do that, then like I was in the wrong line of work. That the absolutely essential skill was going to be to handle crises. And I basically had to figure it out on my own. And so I thought, well, I don't know how I could teach a course like this, but I will put together a course called Public Health Crisis and Response. And lo and behold, there was no course like that. I don't think there are very many courses like that. And I taught it for a few years. And in the process, I had every student write a paper about a crisis and how it could have been handled better. Because part of the premise of the course is crises happen, and it's natural to feel like those crises are the interruption, that the real job in public health is your strategic plan, or it's the long-term, projects you're working on, and that you just get interrupted by these crises. But there's a way to flip that and say, actually, let's take the crisis from the background, put it in the foreground. Your job is to handle these crises, and you actually get momentum and power from doing well in the crisis that you then can apply back to those more difficult long-term challenges that you really want to deal with. And if you think about it that way, then how do you actually manage that crisis well, not just to save lives during the crisis, but to prevent future crises, to win battles that you've been fighting anyway? How do you basically use crises as a power source for improving public health? And my class, the students write a paper about that. And I've had probably 400 students now go through the course, something like that. And every one of them writes about a different crisis. So now suddenly I having read their papers, know about all these different crises that were managed well, managed not so well. And it gives me a sense that like, there's something to this, that like our ability to step up in times of crisis is important, not just for the crisis, but really for the role of public health more generally.
Right. So you're going to have a new cohort of students. They're going to be writing papers. Someone's going to pick COVID. What are they going to say?
Well, that story is being written a little bit, right. I think. I mean, it's. I would say that we can be honest here and say that this is not the crisis we were all hoping for, and it's certainly not the crisis response we were hoping for. In many places, public health has gotten pushed aside. You have a lot of health officers and who've been attacked, sometimes by the very people who have appointed them, other times by legislators or people in the community. And there are a number of health departments that have lost, had key areas of authority taken away from them. So, the kind of model story, which I use as sort of like the archetypal story of, there's an outbreak of a poisoned medicine, like the elixir sulfanilamide, 1937. And FDA rides to the nation's rescue. They empty the agency. The FDA staff go all around the country to find the poison. Reporters are following them, reporting heroically how the FDA staff saved lives all around the country. And suddenly everybody loves the FDA. And the FDA says, we really need more power. And then lo and behold, you get the 1938 Food, Drug, and Cosmetic Act, the first law in the history of the world that gives an agency the ability to review the safety of a medicine before it comes to market, totally tied to the agency's response. That's sort of the archetype. You're not really seeing that in this country right now. You're seeing it a little more in other countries, actually, where the public health agencies are doing a great job. They're empowered, and they are protecting the public, and people are really listening to them, and that's going to enhance their authority to do other things, over time. In this country, we've struggled, and that certainly has been true at the national level with the sidelining of CDC, and it's been true in a lot of states and localities. However, there are exceptions to that. There are places where you really see people learn from public health, appreciate the skills and the value that public health brings. I'm thinking of Rhode Island, Nicole Alexander Scott, or Michigan, Janae Khaldun come right to mind. There are others who, I'm sure they get recognized when they go out because they're doing so many press events, but they've been real voices of calm at this really stressful time. And I think in every agency, this is kind of a moment to say, how do we try to be the agency with credibility, do things that really help, and slowly but surely broaden people's minds to the value of public health.
Yeah, Yeah. So you talked about crisis, bringing it to the foreground. It's not something that gets in the way of our day-to-day work, but rather becomes the day-to-day work, especially of leadership, public health leadership. And I agree with you. And it also exhausts me to imagine that that's the case. So how do we take that fact, which I think you really do a nice job documenting in the book, and I think it affirms a lot of lived experience for many of us in public health, and sustain energy so that it's not this constant, because crisis to me feels like it's 18-hour days, 7 days a week, 20, uh, just a crazy pace. And what I'm hearing from folks in the field is, I'm tired. How do we
Well,
balance
this
that?
is a very, very hard time.
Yeah,
And let's talk about what makes it so hard. I mean, we don't yet see the way out. We know that a vaccine is coming. We don't know exactly when it'll be. It's being dangled in front of us like a little treat, but it's still a little bit of a ways away. Where the cases keep coming back, people are getting frustrated. Everybody's getting frustrated, and public health officials can be the face of the all the restrictions and be the target of frustration. And so, the combination of being exhausted and not being appreciated is sort of the recipe for burnout.
right.
And it is totally understandable, I think, for people in public health to be feeling frustrated and burned out at this moment. And, the things I would say for that is that, you shouldn't feel guilty for feeling that way. And that you should take steps. Certainly, self-care is extremely important at this moment for people in public health. And you have to, help your teammates also be able to take a little bit of more time off so that you can pace yourself. But then you have to, have a strategy to unburn out. What is that strategy? You're going to realize, you're going to tell people, we just have to get a little bit further here. This isn't forever. And one of the things that I would always like to say is like, look, we're not stuck in this situation forever. If you go back just a few months, we thought we might be facing the imminent wipeout of our healthcare system. And, everybody was really worried about that. And in large part because of public health, we avoided that scenario. And of course, so many other things happen that we just think we're constantly busy, but we've been climbing a mountain, and you can occasionally look back down and see how far you've come and realize that we will get over this. I mean, we will get to the top. This will be behind us. That's a really important thing to remember. And then I think, public health is able to, perhaps better than medicine, do great work without appreciation.
Right.
We're used to that. And I think that finding ways to appreciate each other. And I think over time, you're going to find ways to be appreciated. The other thing is, and this is, I'll tell you what last point here is that I think of when you're facing a really difficult challenge, and we could call it COVID, we could call it racism, because racism is very much a crisis right now, that I like to think about the approach that you take in public health is like a portfolio. You're doing some things that are going to pay off in the short term. If you just did those things, it wouldn't be enough. But they're momentum builders, they're competence builders. Then you're going to do some things for the medium term, and then you're going to be plugging away at the real long-term changes that are really important. If you just do the long-term changes, if you say the only thing I'm going to do is try to change this enormous, difficult structural roadblock, that's a very worthy cause to be doing. We all should be working on that. But if you just do that, it's very, very easy to burn out because it's so hard. But if you're doing that, but some percentage of the time you're doing some other things, then it can really help, with the momentum and even against those really serious problems. I'll give you an example. I remember when I was health commissioner of Baltimore, and I was trying to convince someone out there to help me expand access to drug treatment in some way. I think we wanted to get some clinics to be more engaged in drug treatment, and it just seemed like the immovable object, and we were working on this, and I was down, and my chief of staff, Michelle Spencer, said to me, you look like you could use a press release on pets. And I was like, a press release on pets? Well, it's getting cold out there. We should do a press conference on how you keep your pet warm. And I was like, oh, come on. I mean, I'm the health commissioner of a city. I can't do that. And basically, you know, she said, well, um, I think you need a pet release on pets. So we did it. We brought in the animal shelter. We had a dog wearing little booties. We had, you know, the whole thing. And it was like a dog whistle for press within 100 miles. Everybody came to the press conference. Everybody was so excited about the idea we would talk about this. And while we were there, we talked about flu vaccine. We talked about other things. We got saturation media coverage. Now, it probably goes without saying that a health commissioner who only talks about the weather and pets is not doing their job, right? That is not a good health commissioner. But you do it once. It was like from the afternoon to the next morning. That's it. And it cheered everybody up, you know? I mean, it was a riot to see the pets. And then the next day I go to this meeting for the 80th time about the expansion of addiction treatment. And the person says to me, oh, that was so important what you did. And that was just so great because I'm so worried about my little, you know, rover. I forget the name, you know, in this weather. How can I help you, Dr. Sharfstein?
There you go.
You know, and then I went back and I was like, you've got to be kidding me, you know, but there's something to momentum. There's something to a sense that you can do things. Taking action is, I think, a very important lesson of history, even if it's a small amount of action, rather than just sort of raising your, you know, fist to the wind, you know, I want to accomplish this. You got to do that too. But you can take action in sort of a balanced way and generate momentum for some of those bigger fights.
Yeah, yeah. Well, that kind of leads into another question I have for you, which is, you know, we're dealing with this global pandemic. We're in the middle of a public health crisis par excellence.
Am I saying that people should be doing a press conference about pets and COVID?
Yeah.
I'm not necessarily saying that,
you know,
although I heard a cat got COVID. Yeah,
yep.
I bet people would cover that.
Yeah. No, it was. I saw it.
If you only did press conferences on dogs and cats and COVID, you would not be a good health officer. But
right. But we're in the middle of this crisis. And then we have the events in Minneapolis. We have the George Floyd murder. We have a new attention to race relations, anti-racism. Folks understandably upset both by the inequities that COVID has shown, as well as police brutality. And folks saying, yeah, we got to pay attention to this. That this was a problem, now it's a crisis. Does that work? Like, how do we make sense of racism as a public health problem and public health crisis?
Sure. Well, I think one of the most frustrating things for many people is that these challenges and failures of the police are not new. You know, they've gone back a long time. And suddenly, you know, people get cameras and then now people are talking about it. And that's a very painful thing for many people, understandably, because it's been infuriating to people that other people haven't cared about this. And that this has remained, as I think you said, it's been a problem that people have been really frustrated by, but it never kind of poked through to become a crisis where all of society said we have to do something. And that's enormously frustrating. We're now on this point, though, that because of that video, we're seeing a response. And that's how I think about crisis. Crisis is that moment when people say, we got to take care of this now. This is so important. Sometimes crises are caused because you have a pandemic or there's a massive storm or whatever is happening. It's going to be a crisis. Everybody knows you have to pay attention to it. Other times, crises happen for completely, different reasons. It could be a video. It could be a investigative piece about a Hollywood producer who is accosting and raping women, and suddenly it causes a crisis that goes way beyond that particular story and has a huge impact. And so I think that you have to acknowledge that just because something is a crisis now doesn't mean it wasn't a huge problem before, that there are lots of reasons, including some reasons that are unfortunate, why things may become crises in certain periods of time. But when you're there, when you're in the crisis moment, what happens next really matters. And I think one of the lessons of history is crises can be squandered, people can pay attention, but there's this enormous counter reaction to want to go back to the way things were. And so part of the job of public health is to say, when there's a crisis, let's figure out how we can learn the lessons, how we can use the attention that a crisis brings to actually bring about lasting change. Why was it that there were certain crises in FDA's history that led to massive changes in food and drug law? The other big one was thalidomide. Interestingly, thalidomide, caused birth defects, was never approved in the United States. It was the work of a great FDA reviewer, Francis Kelsey, who said, I don't think this drug is safe. It came in on a much smaller scale in the United States for research, and there were a small number of babies that were affected. They were thousands and thousands, probably more than 10,000 babies that had severe birth defects in Europe. But it was the crisis in the United States was caused by the recognition that one drug reviewer, Francis Kelsey at the FDA, prevented all this harm. And there was a huge story about it. There were hearings about it. President Kennedy got involved. And before you know it, you have a massive policy reform in the United States. At one point in one of the debates, someone said, like, I thought things worked out pretty well here. Why do we need another law? And it's like, no. We have to take advantage of this moment to really protect ourselves. And that's how we got laws saying that medications need to be studied for effectiveness before they can be approved. So I think like you have examples where it really came together. There's a lot of skill, I think, in thinking about how to manage through a crisis so you get lasting change and not have it squandered. And that's really the moment we're in, I think, both for COVID and for the appropriate attention and crisis that is around racism. And, how do you do that? How does a health agency become, relevant to that? And I think, one of those ways is really by doing things, by being present and showing that you're on the side of the crisis. You're part of the solution to the crisis, and that builds credibility. Now you can do that in partnership with others. You can do that through actions and authorities that the health department has. But I think it's extremely important to be active in that way. And then also you need to be able to explain. I think the role of explaining is very important. And so in the book, I talk about take action and give a good explanation. What's really happening here? What's really happening? And if you can communicate well, then you get credibility from the action you've taken and how you explain. People then start to see the problem the way you do. And then you come in with a specific solution or set of solutions. Here's what can be done outside of the police to address violence. Here's what can be done to strengthen the public health infrastructure. So I think there's a path to do that. I think there are, some ways to slip up. And I think obviously the politics that we're in now can make it very difficult. But I do think that there's a path. And I think everybody who's concerned about these issues should be thinking not just about what's happening in the moment, but how we can use essentially the power that a crisis brings to bring about change that would otherwise never have been possible.
Yeah, excellent. So thinking about this issue of COVID is a crisis to those of us working in public health, but we've also seen a lot of Americans not even believe it's a hoax. They don't want to wear a mask, don't want to social distance. We suggested action, and it wasn't taken. And how do we process that as public health professionals? What's your take on that in terms of this particular COVID crisis and sort of the disregard for science and public health authority, if you will?
Yeah, well, I think it's been one of the most painful things to watch. When I started, actually when COVID was going, I was teaching my class on public health crises. And so I had the book handy. We were talking about, well, now's the time they'll put CDC forward in order to explain things to the people. Of course, that wasn't happening, Now's the time when we would have a lead public health communicator who'd be the main voice of the government's response, who could really explain things to people. That didn't ever really happen. It was so bad that on the last class, by then, our school had closed, the building had closed, and we were doing it by Zoom. I invited some Washington Post reporters to join. And my students told the Washington Post that all that stuff Dr. Sharfstein taught us about what should happen, none of that's happening, and so there was just this huge disconnect. And they wrote a story about the disconnect between, the CDC's playbook on public health communication and what was actually happening. And it's enormously frustrating. And why is that happening? And it's, I think one of the lessons that we're learning here is that we exist in public health in part because of the leadership that we work for. And it can be a very productive relationship. I had the honor of working for a great mayor, a great governor, a great president, in my opinion. And, it was the feeling that, you really had a role when there's an elected leader who is undermining a public health agency. The public health agency is in trouble. I just think that maybe we don't want to believe that, but I think this experience has really shown it's very hard to maintain the level of impact that we want to have in public health if the political side of it isn't really aligned. That doesn't mean people have to agree with everything or defer on everything, but if without a real basic level of trust and respect, then it makes it a lot harder. And I think that we're learning that lesson right now. Now, I do think that the people who can be very noisy and not believe anything or be attacking public health are very much a minority in this country still. And I think that it's very difficult, particularly if the political support isn't there. But I don't think that this is a permanent situation. And I think that what's very important now, I'm not sure what's going to happen, but I think it's very important for people in public health to stick at it, to stick with the science, to talk about what's necessary. And eventually, I think people will come around. And I don't know if it was Winston Churchill who said Americans will do the right thing after having exhausted every other option. But you're starting to see that, with masks. Right. Some of the people who are like, what's wrong with these public health officials for suggesting masks are now imposing mask mandates themselves. And I think that, we can't lose a battle on one day and convince ourselves we've lost the war. We have to realize this is a much longer situation. And that when you stick with science and you have science on your side, things will tend to line up, I can't think of a better example of that than Dr. Fauci, who has taken on this iconic status. He's the icon, Yep. And that, he was there. People were saying he was totally wrong about hydroxychloroquine or whatever. And he just stayed steady. And the president's wondering why he has much higher approval ratings. It's because he's representing the best of public health. Public health will be there with the high approval ratings if we can stay the course, even then on any given day, it may be painful and difficult, and there'll be a noisy minority of people who are going to be upset.
Yep. And I'm sure you've had in your various positions your share of vocal dissent, working in a city, working in a state, working federally at a huge agency.
Yeah, let me tell you, can I just say something about that? Because I'll tell you that, at least for me, what made that more bearable, which is I would always try to ask myself, why are people upset? Why are people so upset? I didn't mind meeting with people who are upset, even if they were really angry at me, usually. Like, why are they upset? I didn't really like the inside the beltway faux anger, where it's like, it's a lobbyist, like, I can't believe you, that I didn't have a lot of patience for. But when people came because they were upset they're worried about their kids, or they're worried about getting health insurance. We had a miserable launch to our health insurance exchange. Like, they had every right to be upset, or if people are out of work now, I understand why they're upset. They may be directing it towards, the health official, but they're really expressing their frustration, anger, and fear. And I think it's important to get just the tiniest bit of distance, to not feel it all so personally, even though it's being expressed personally, and to try to express, understand, see it a little bit, from their side. And I do think that helps with the coping, because it's very hard if you feel it all so intensely personally.
Yep, we've been talking today at ASTHO about telling different stories, learning different stories, hearing different perspectives, and how that makes our work move forward. One of the questions that's come in over the Q&A, and I want to turn to some Q&A now of our participants. Someone asked, do you have any hints on unburning out for public health and healthcare workers? What's one way that you unburn out or recommend unburning out?
You know, I do think that there is an issue of self-care, finding time for yourself in some way, finding something that you do that is relaxing. You know, I mean, I personally find cooking relaxing, and whatever it is that you find relaxing, just to try to protect that time. I think that is important. I do think that the team that you're part of and the camaraderie you have is very, very important. If you feel alone, that's one of the worst things about the pandemic, is that people just aren't together.
Right.
You know, and I think that's probably making it a lot worse, because I can remember some very difficult times. So we had a team, we were looking out for each other. You know, that the camaraderie in public health can be really amazing. It's harder now, but I think you've got to go the extra mile to try to build that.
Yeah.
And then I think what I was saying before about trying to build a balanced portfolio. So you're doing some things that bring a little bit of credit and fun to public health. You know, I'm not saying to do anything silly or frivolous, but, you know, something that has a shorter term impact. You can get a good news story out of. Again, if you only did that, that wouldn't be good, but just something to kind of build up the sense that, you know, yes, there are a lot of good things public health can do and build some momentum.
Yeah. Question about, back to the idea around science and maintaining public trust. You know, how do we balance what we know is evidence-based and factual from some of the stories that are posted on the internet, and, you know, folks that are looking for that one thing to prove public health wrong? How do we balance that? How do we develop public trust when they can go find a study that discredits everything that we just said in a press conference?
So, a couple things. I think it's important to realize that we are not isolated and alone within public health. I think there are natural allies in medicine right now. Like if you're working in an ER or an ICU, you don't want to see a lot more COVID cases. You know, I think there are allies in the business community. They really want to see fewer COVID cases. I think, you know, the typical idea of like, I'm just a health department, we're just going to go out and tell people what to do. You know, you may have the authority to do that, but if you can do it standing next to, you know, the trusted healthcare providers, the trusted businesses in town, I think that that's easier. And it points, you know, it basically helps guard against, I think, that feeling that it's just everybody's coming for you. I think that when you have these questions that come up, you want to funnel them into a process where you can handle them. So maybe you have a Q&A document, you know, that you put on the website, and somebody asks you some question. You can say, okay, that's a great question. We'll handle it in this week's Q&A document. So you're not, you know, feeling pressed at that very moment to know every single thing about every crazy idea that somebody has on the internet. You know, I heard a study that hydroxychloroquine doesn't just, you know, cure your COVID, but it also takes care of your high blood pressure. You know, it's like, what about that study? It's like, I haven't seen that study, you know, but why don't you send it to me, and we have a Q&A, you know, we have this process where we will look at it and we'll tell you what we think about it, you know? So I think, like, take the edge off, put a process around it, you know, and be with allies. I think those are different ways to not make it so intensely personal.
Sure. Someone has asked, what's been your biggest challenge, and how did you overcome it?
What's been my biggest challenge? So I think that we had a huge challenge when we launched our health insurance exchange and it didn't work. And we were very worried that people would not have health insurance when January 1st came around. And I was a big challenge for me because I blame myself completely. You know, I mean, I think one of the things in public health, candidly, is that you know, sometimes we get blamed for things that have nothing to do with us. And we can at least say, well, at least I didn't do it. But there are other times, you know, people make mistakes, or at least they have responsibility. And it's within their area of responsibility that something doesn't go right. And to feel responsible and to feel bad about things is human, you know. And it was very hard because, you know, I wanted people to get insurance more than anything in the world. And suddenly the website, you know, to get insurance didn't work. And that was difficult. We had to make a whole bunch of different changes. And it was very important for me to be honest with people about what was going wrong. And so I got personally a lot of criticism for that. But I was basically saying, look, we're going to fix it. We're going to do whatever we can to fix it. I'm not, you know, and I think one of the key things in retrospect was that I was able to maintain credibility even as I was explaining, yeah, you know, wished we could have done it differently, wished this other thing hadn't happened. I pointed out that we had contractors who had failed us in some ways, but I accepted responsibility and apologized. And the credibility that I was able to maintain gave us the ability to, you know, swap out our system. We unplugged one system, we put another system in, and then we stuck the landing the second year. And we have one of the most successful exchanges in Maryland. I mean, I look back and it's just amazing to me after how difficult it was to launch. And that wasn't just me, that was many people on the team working together. And I think it was the team spirit that kept us going. But I think, you know, one of the just critical parts of that was maintaining credibility and being honest and talking about it as a human. I mean, I said, like, there's nothing I wish more than this thing would work so people could get insurance. And we worked on all kinds of ways to make sure that people didn't fall through the cracks. We talked about how we were working on it. And I think people appreciated the situation that we were in. And so I think in this kind of situation, if there are mistakes made, if you wish you had done something differently, that's okay. You know, and you can basically say, look, I'm part of this community too. There's some great health officer statements where people are saying, deciding what to do here is a gut-wrenching decision, you know, and I've got kids. This is what some of them are saying, you know, I've got to decide what to do for them. And here's the decision I made, and here's why. And now that we know something different, we're going to make a different decision. And if people can see you in that way as someone who's really trying and working and taking action, I think that people underestimate the ability of the general public to appreciate that. We're not exactly in a culture of taking responsibility these days. And when people do that, I think it can be much appreciated.
Stands out. People remember it. Yeah. Someone asked, do you have any specific thoughts on how we can keep public health a priority after this pandemic, and also use it to be more prepared for whatever might be next?
Yeah, well, I think that is very much the challenge. I mean, I think we have to manage through this pandemic and position ourselves to pivot to how to avoid being in this situation again with such a weak public health infrastructure, with, you know, being sidelined right out of the gate, all those things. We've got to think about the response and the pivot. Now, you know, one of the things that's in the book and I teach in my class is you can't do the pivot too soon, right? Public health officials couldn't say, like, forget about the crisis, this crisis, let's just talk about the next crisis, because people will think, like, dude, your job is this crisis, you know, like, why would we listen to you about the next crisis if you're not doing a good job now? Right. So you can't just do the next crisis discussion, but it's got to be in your mind. And I think what you do is you manage, you take action. Again, you do that portfolio, some short-term, some medium-term, some longer-term projects that you're working on. And you find ways to slowly but surely introduce the causes of the problems that we're having now. You know, it's too bad we don't have electronic reporting, because we could have helped. That could have helped. You know, you start talking about the kinds of things that you're making your little agenda for later. You're planting seeds that are going to come out later. And, you know, I'll give you an example. We had a plastic surgery spa in Maryland that was a horror show, and people were getting these horrible infections, and we had no extra licensing for them at all. And what happened was, you know, we shut down the facility, and in that press release where we shut it down, we put in one sentence at the bottom, which was, In Maryland, there is no licensure for these medical spas. In many parts of the country, they do have licenses for these medical spas, you know, and people didn't notice it the day we put it out, but we kept coming back to that issue a little bit more, a little bit more, a little bit more, till eventually the families of some of the people who died took that on as an issue, and we worked with them and got legislation, you know, passed, which would never have passed before this had happened. But if we had just talked about, we could have easily said the problem was just that doctor, and boy, we took that doctor's license away, so we're all good. But instead we said we have a structural weakness here, and you know, eventually we got legislation to address it. So I do think you need to think about that pivot. You need to be planting the seeds. But job one is doing the best job you can on the crisis and building up your credibility.
Excellent. We've shared some pretty great advice. We're coming to the end of our time together because we want to be mindful and not burn people out with too much Zoom. I learned the word zombie. It's a zombie.
Very good.
Too much Zoom. But I thought
we all have our coping mechanisms. Can I show you mine here? I have a little friend who is with me.
There's your little friend. Who's that?
That is Luna. Yes.
Knocked out.
Yeah. Well, hopefully the people who are listening are a little bit more awake today. But
yeah, I think they are.
Having Luna with me, that's a good.
That's good. That's good. We got some good, great engagement here. But I thought maybe we could close with just one last question. Going back to the beginning, this is about insight and inspiration. We all have an opportunity every day to kind of start fresh. What gets you up in the morning? What's the juice that moves the Josh machine forward?
I don't think anybody has asked me a question just to put it that way, Mike. I'll be honest with you. I do think that this is one of those moments for public health. You know, this is one of those moments when there are many different possibilities about what can happen. And I am, you know, pushing myself to take every opportunity to talk to different audiences about how important public health is at this moment. The business community, I've had 100 times the usual exposure to the business community. Anybody invites me, I'd say I'll do it. You know, senior housing administrators, managers, just wherever people are coming from, K to 12, you know, teachers and principals. You know, there's a whole world out there, and this is a moment where people are very worried, and public health has a lot to offer. I think it's also true on issues of race and racism. And we've been using our podcast, Public Health on Call, to explore those issues too. Every time you can get an audience, it's important to take it. And you don't know where it's sort of like intermittent gratification. You don't know when you're talking to someone whether people are really listening. There's just no way to know. But you know that at least you have the chance to talk to them, and that if you keep doing this and you keep, you know, explaining what public health is, talking to the science, talking to the values of public health, that many people will start to appreciate that, and that will be part of the legacy. So I think about, you know, all the things that we're all being asked to do, and you can see them as hassles, you can see them as miserable Zoom meetings, you can see them as many things, but they are totally opportunities. Like, our field has a moment now, and we just have to take advantage of it as much as we can. And we're doing that to save lives in the present and to have a much different tomorrow than we had before.
Thank you, Josh. This was a fantastic chance to learn from a public health hero, from an icon, as I mentioned. I know you don't want that mantle, but I think it's true. We really appreciate all you've done, and I really do want to remind folks that this book is literally the textbook on public health crisis survival, and so hope that folks will have the chance to read it. And thanks for all you've done for ASTHO.
Thank you so much, Mike, for having me.
You bet. And I do want to remind folks who participated today that we also have an opportunity in August for a similar conversation with another thought leader from outside of public health. We'll be hearing from Tom Nichols, who wrote a book called The Death of Expertise. And it taps on some of the themes that we discussed, Josh, around science and discrediting science, and how we make sense of a world where expertise is second to a Google search. So it should be an interesting conversation August 19th. But for now, thanks again for the opportunity to pick your brain and learn a little bit. Thanks for your mentoring of many of us moving forward. And I'm really excited about the inspiration that you shared with us and appreciate your time today. And with that, I'll say thank you again, and thanks to our participants for joining in. We hope we met our goal of inspiring and providing insight for our public health workforce.
Great. Well, it's my pleasure. Great to see you.
Thanks, likewise.